You might think that if a food could make you sick, it would be pulled immediately from store shelves. But today, the Department of Health and Human Services Inspector General reported that hasn't always been the case. Anna Werner is following this.
In a 49-page report, the Inspector General's office reviewed 30 voluntary recalls overseen by the FDA, most of them high risk, and found the FDA could not always ensure that firms initiated food recalls promptly. George Netter headed up the investigation.
23 of the 30 recalls we looked at were Class 1. By definition, can cause a serious, irreversible medical condition or potentially can cause death.
For example, auditors found a recall of cheese products linked to a 2014 listeria outbreak took 81 days to complete. An infant died and 2 pregnant women lost fetuses. And in the case of an adulterated dietary supplement, the firm did not recall the product until 303 days after receiving a warning letter from FDA.
At 3 places for that one recall, that stuff was still on the shelf when they went out there 303 days later. That meant people could have been buying it up to that 303 days.
So this product potentially jeopardized lives, and they left it on shelves for close to a year?
That would be correct.
Investigators were so concerned by what they were finding, they issued an alert midway through the review in 2016. At that time, FDA put a special team in place to focus on challenging high-risk recalls. Now, in response to this full report, FDA said the 30 cases selected were extreme outliers and claimed in the highest risk recalls, recall initiation took place on average in less than 3 days. But Netter disagrees.
I have serious concerns about that analysis.
Why? Because his team found in roughly a third of the cases they examined, FDA had put the wrong recall start date into its database.
So basically you're saying when they say it's 3 or 4 days, you're saying they don't really know that because their dates were wrong.
I'm saying that their system, from what we found, could not be relied upon during our, based on our sample of 30 items.
In a statement to CBS News, FDA Commissioner Scott Gottlieb said much has changed and the agency has worked quickly to put in place measures to address the proposals the OIG outlined. But he said he knows much work remains to be done to assure safety. Elaine.
Sobering report, Anna. Thank you.